A lot of progress has been made since the first World AIDS Day 25 years ago. Treatment is better and those with the disease are living longer, fuller lives. And while researchers in BC say there is a reason to be optimistic, they also say there's more that should be done. Kurt Petrovich has details.
Free hugs right here.
You can't argue with the price, and volunteers say their message to lift the stigma around HIV and AIDS is invaluable.
I'm not HIV positive myself, yet I encounter stigma all the time. When I tell people I'm from AIDS Vancouver, there are people that all of a sudden don't want to shake my hand.
20 years ago, this man lost his partner to AIDS, but he says dropping infection rates is not a time to be complacent.
Even though the numbers may be going down, if the public education isn't there, we once again run the risk of the numbers going back up.
According to the BC Centre for Excellence in HIV/AIDS, an estimated 71,300 people are living with the virus in Canada. In BC alone, about 14,000 people have HIV. 20% may not know they're infected. But there's reason for optimism. Only 238 cases were reported in BC last year, the lowest number of new infections since health officials began keeping track, and the largest rate of decline of any province in Canada. Thank a BC strategy known as Treatment as Prevention, or Seek and Treat.
We know that we really have to go out and offer HIV testing to people who may not know they're infected so that they can benefit themselves for getting on treatment, and also, by doing so, reduce potential transmission.
Aggressive testing followed by powerful antiretrovirals has caught China's attention. This week, BC signed an agreement in Beijing that will see expertise transferred to a country with more than 700,000 people living with HIV. Some question why the Harper government has been mute on either a monetary or moral endorsement of the strategy.
It just seems so very short-sighted and obviously in some instances callous, even when you can prevent a disease from spreading and you don't do it.
The federal government has committed money to find a cure, but there are those who wish Ottawa would recognize what already seems to be working and embrace it. Kurt Petrovich, CBC News, Vancouver.